Good morning, everyone. Welcome to the first, we're going to do this every week, weekly patient advocacy chat. We're coming live from, thank you, RPH Ally and the Patient Advocacy Channel. I am the host, Dr. Andrea, a pharmacist with, this year, 30 years experience as a pharmacist turned patient advocate. And so I don't practice traditionally as a pharmacist. I know, I know. I don't practice traditionally as a pharmacist anymore. I'm solely in patient advocacy. And this morning I have a fantastic co-partner, co-pilot over here, Dr. Kevin Walker. He's coming West Coast. I'm on the East Coast. So we're covering the whole continent. And we are going to be chatting about the top 3 myths that I find people have about patient advocacy. Welcome, Kevin. Thank you for waking up incredibly early on your side.
So good to be here, Andrea. Super excited for your shows. You always are just a wonderful wealth of knowledge. And 7:30 in the morning, it's good for me to get a spark. So Andrea is a good spark to start my day on the West Coast.
Well, I just got off the rebounder. I went and did a 15-minute quick rebound session to get the blood flowing. So I'm excited to be here. Huh?
What is a rebounder?
The mini trampoline. That was my jumping up and down.
Cool.
I'm finding that I'm losing some balance on my boat, and I thought rebounding. So, you know, the
Genius.
Different planes of action and strength training. So, yeah. So for everybody that's watching, you don't necessarily want to hear about rebounding, although we can always chat fitness because I do that as well. We want to keep these kind of tight. And so I'm going to cover 3 myths that I commonly hear. And while people don't necessarily express these myths, you can hear it woven into the conversation when I talk about patient advocacy. So the 3 are, 1, their family. It's expected of me, or they'll think I don't like them, depending on how they want to phrase that. So it's basically, it's an expectation, or their family, what else would I do? The second myth, that hiring an advocate is a reflection on my intelligence or my knowledge base or whether I'm smart enough. So they view it as if they might not be capable, and that it's almost like a slight. And the third myth is that it's too expensive. Okay. So those are the top 3. Kevin, have you ever heard anybody talk about that? Have you ever encountered anyone that's used a patient advocate or somebody that's expressed these concerns if you've mentioned it?
The last 2, Andrea, are ones that I had heard of before, you know, that they is a general feeling like you only need advocates or folks that don't know what they're doing or don't have the ability to find out themselves or don't have the right network and the payment piece. But the first one I really love because that's interesting. And I'm sure is often not, maybe it's not verbalized as much. That's why I haven't heard it, but it's probably when you really dig down deep, the truth.
Right. So we're going to talk with that first one. Myth number 1, they're my family, or they're my best friend, or it's my spouse. It's an expectation, or why would I bring in a stranger? Basically, I'll be perceived as if I don't care if I have an advocate. What I like to talk to people about that might have that concern is I talk about the times when my mom had cancer and my dad had dementia. And I'll use my dad as the example because we are keeping this tight. Towards the end of his life, the last few months, he had a traumatic fall. He fractured his neck, and we were in constant chaos. And me, being a healthcare provider and an advocate, immediately stepped in. Right. In hindsight, what I found myself doing was not being fully present with him, because in the moments when I was with him, I was running decisions through my head, or I was running assessments through my head. Oh, today he ate 5 raspberries. Yesterday he only ate 2. This must be good. I have to make sure that I talk to the nurse about this because this is progress. I need to be documenting. Oh, I have to call the insurance company to find out how many days of stay he still has. What are the expectations? So the time that I had with him, even though I knew that it was going to be relatively defined, it was, you know, he was not progressing as we hoped, I was constantly fragmented in my thinking. So instead of truly being with him, I was in my mind problem solving and missing opportunities to be with him. So this whole question about, or this concern is, you know, people will perceive I don't care. That's not what it's about. I work on the assumption that they're family, you love them, and you want what's best for them. And in a moment of chaos and confusion, or even just high stress, when can you bring your best self to your family member? Is it by loving them and caring for them and remembering to bring the fuzzy blanket or remembering to bring them some food, things that we forget? Or is it spending 5 hours on hold with an insurance company? And so it's not care that you don't care for them. You want to be able to have the bandwidth to do what you do best. Be family.
Man, that's perfect, Andrea. I mean, I know like my busy mom with 3 kids, when she was taking care of my grandparents, even not during the death process, like it was just putting extra responsibility and burden on her very tight schedule already. And thankfully she just operates with grace, but it could make it really stressful to go home at night and decompress. I remember mom just being stressed, in general. She didn't have someone to be able to lean on. It was all her. So I love that. Wow.
Right. And it's not taking away from the family. I mean, the family, and when you work with an advocate, it's basically what's working, what isn't. And then offload the heavy burden, the heavy lifting. And if you love doing something, then, like if you love meal prep, awesome. That's not something I do, but allow yourself to do that, right? Without all this other stuff. So that's myth number 1. People will think I don't care. I disagree. And I'm happy to talk about that. Number 2, it's, I'm not smart enough, or people will perceive that I'm not smart enough. I heard this recently with a client that's in an immediate situation. They're in an acute setting right now. And there's the comment of, I'm generally pretty smart. I'm generally tech savvy, but right now it's just all gone out my head. Yeah. Well, of course it's all gone out your head. You're sleeping in an emergency room with the person that you love in crisis, right? Why would you expect to be able to remember it all? It's not a reflection on your abilities. It's not a reflection on where you are traditionally. And it's not a reflection of how you're holding up in the moment. Stress is stress, and we all experience it. I can remember when my mom was in the emergency department. I mean, it was like I could only hear like humming in my head, because I couldn't even process what people were saying. Like, she had a bad drug reaction and now they're saying she's going to die. And I'm like, wait, 4 hours ago, she was sitting and wanting Sonic. How can we be talking about death already? I mean, and so in chaos, our body goes through fight, flight, freeze, all these different things. And it's not a judgment or anything on your intellectual capabilities. And it is also not about the advocate telling you what to do. Advocates offer navigation support, or healthcare navigation or decision support. So it's bringing options to you, pointing out opportunities, asking questions that you might not see. It's not an intellectual judgment.
I love that.
So that's stress to take off the shoulders. And then the third one, it's too expensive. Okay. So I think it's best to use a scenario and then just point out some aspects of advocacy. First of all, advocacy generally is not covered by insurance. There's a large discussion around this, whether it should be, who should be paying for it. The people who need it most don't get it. And I hear all of that. And it is a challenge. And every advocate seems to work on a different system. Similarly to every personal trainer or yoga instructor or subcontractor of other aspects of your life, right? And so it generally is a fee. Although some people have found that within like a long-term care policy, or some kind of HSAs where you have more discretion with fees, you can use that money how you feel best serves you. And advocacy might be that best option. But when we talk about, is it too expensive? I'm just going to use an example. Yeah. Imagine you go to the emergency department and you are put into observation. And if you work in healthcare, you know that observation, that when you go into an emergency department, how you're classified, where your bed in essence is. Are you being observed or have you been truly admitted? That matters. Particularly if you're older, if you're over 65 or if you're on Medicare, traditional Medicare requires a 3-day hospitalization inpatient with a qualifying event, not counting the day of discharge, to be able to get services post-stay. So let's say you go into the emergency department, you're there for a couple of days, but you're in observation. You have to have some kind of procedure or surgery, but you're not there for 3 full days, not including the day of discharge. and you're you're required to go home or to go get some kind of care afterwards, Medicare could push back and say, hey, we're not paying for that. You didn't have a 3-day qualifying stay. So not only are you looking at this bill potentially through your insurance, but now the aftercare, you may have to dispute it. You may have to, try to get coding changed, which, once it's in, you might as well be in. Granted, it can be challenging. And so by having an advocate with you, even before you hit crisis, and that's a whole different topic, because while an advocate can certainly step into the immediate situation like I did this weekend, it's far easier if we have time to get our feet under us. But if you think of what the costs around that, paying somebody for a couple of hours or however that advocate works, I work on packages and situations and per hour, to be able to say, wait a second, why are you still outpatient? If they're going to do surgery and you're going to need aftercare, why are you not inpatient? We can at least ask these questions. I can't make them do it, but we can certainly ask. And if we aren't getting a response from the hospital setting, we can contact our primary care doctor and say, hey, can you call in and find out what's going on? If we're getting stonewalled, there are ways to work within the system, but then we can also contact our primary care. So when you look at cost, we have to think of what is the value of your time being where you are best served with your loved one? Or is it trying to find, all these other failure points of the system? And I also just like to point out, oftentimes I'm talking about you're the family member, you've got a loved one. There's a lot of people that are solo flyers, right? You're going to age alone. You don't have children, maybe. You don't have a significant other or spouse. You may have a good friend, but can that person just stop their life to come and help? And so if you're alone, imagine trying to do all of this from the hospital bed yourself.
Yeah.
Are you thinking to ask questions like, wait a second, how am I coded? Wait a second, I have a do not resuscitate, or I want to be full code, or, all these different things, all those checklists that we go through, looking at your medications, asking the questions about what happens afterwards. Are they, do you want your own fuzzy blanket? All that stuff that an advocate can bring. Is that worth not only potentially saving thousands from a coding or an insurance challenge, but also just for that peace of mind?
Wow. Yeah, I feel for me, Andrea, like the knowledge you just dropped there really makes me think of what you were just saying. We'll talk about in a later episode, is a pre-advocacy plan. Like when everything hits the wall, like it makes it very difficult to make good decisions and even find really good people, to be able to connect with and make those decisions. So it's like you and I talking about power of attorney or getting your last will and testament kind of put together, an advocacy plan of being able to say, when everything hits, call Andrea. Like that, we already have everything laid out on how we want to do things. That's so interesting. I love those top 3 myths.
Absolutely. The pre-admission session, or just trying to get your feet under you so where everybody knows where everything is. My sister and I were sitting on a beach in Florida when my dad was hospitalized. We didn't know he had dementia. We knew he was slowing down. We knew it was a little confusion. We had just been told he had severe sleep apnea. We thought that was what it was. We're sitting on a beach. We get a phone call from an emergency department. The next morning, they wouldn't speak to us. We're like, he was just there. You guys were talking to us. They had transferred him to a psych ward in the middle of the night because we weren't there. I'm trying to get back to Tennessee from Florida. Our power of attorney, thank goodness, we were able to get a hold of the attorney to send it, but we didn't have that on us. Now, of course, I know about electronic documents and keeping these on file in a DocuBank. But in the moment, while it's great you have the power of attorney, we'll hope you have it. But if it's in a safety deposit box and the person that has the other key is actually the one in the bed, what do you do, right? And so that pre-session, I have someone right now that I'm working with, and it's a month-long process. We're doing the checklists, setting a foundation and a baseline. Everybody knows their roles. They can all go and live their lives. But if something happens, everybody knows what they're going to do.
I love it, Andrew. I know we're running up on time, but I'm really looking forward to covering that next time.
Yep, we can certainly do, because I'd love for that to be the next topic. We'll just walk through what the baseline session is through advocacy.
Ooh, love it. All right. You want to sign us off?
I will. Yes. So everybody, that was it. Thank you so much for joining the Patient Advocacy with RPH Ally. If you have not joined RPH Ally, I encourage you to go over there. It is not a fee for everyone. I know that there's been some questions. Talked to somebody this morning about that. You can join pharmacists, pharmacy techs. You can join the platform. There's lots of free content that comes across through multiple disciplines. And then you can even go into specific channels. You'll find even more free content. And then there are options to be able to work with folks like me on how to launch an advocacy company or business, and lots of other folks there for support. So I hope you join us, and we'll be back next Wednesday, same time, same channel.
Ooh, first episode. Excellent. All right, everybody.